What surprised me most in this study was that the bacteria, oral bacteria, survived. Typically, I think they would not. However, after disinfection, we still find it. Now, that could be due to the nooks and crannies in the bib clips. That could not be wiped clean. However, a few bacteria made it through the process. After cleaning, 70% of the bib clips still were contaminated. The types of bacteria that were found on the clips after cleaning were still species from the oral cavity, such as Streptococcus, Prevotella, and other common species. We also found those species that are often found on the skin of people. Now, these could come from the patient, or they could come from the clinician. As a researcher, the most important part of the study is that there is indeed a risk of cross-contamination. So a patient, the previous patient's oral bacteria, for example, can potentially still be on the clip, and you have the new patient has a chance of infection. The problems that these bacteria, these surviving bacteria, can pose to the patient is that you can get infected. The risk is minimal, however, it is still there because you don't know the health status of the previous patient. It's very important to be able to have as sterile environment as possible. Given that we found bacteria after disinfection poses a risk to the patient. We can avoid that. We can either have a better means of sterilization of the clips, we can use disposable clips, or we can use clipless bibs. Oral bacteria can get onto a bib clip by at least two different methods. One would be the spray from the treatment. As you know, in the dentist's chair, you get lots of aerosols. Or two, they can come from the clinician with contaminated gloves. Based on the results of this study, the patient should watch out for a couple things to avoid contamination. First of all, the gloved hand. It should always be a fresh pair of gloves. If it touches the bib clip, if it touches their face, it touches anything other than your mouth, you have the right to ask, please change your gloves. The risk of contamination is especially problematic for people who are more predisposed for disease. In other words, they're more susceptible to disease. If people have colds, if they're HIV positive, for example, any type of, if they're immunocompromised in any fashion. So there are certain people that might be more at risk.
When a dental hygienist is doing a cleaning, there are certain machines that they use that spray water out of the patient's mouth. The water goes all over the place, all over their face. I'm sure you've felt it on your face. It goes down on your neck and certainly would affect the bib clips. After looking at the study and looking at the bib clips that we're using in the office, although we've been sterilizing them, we're still not convinced that that's the true answer. So I think we're going to go more towards a disposable system at this point. A patient would know if a bib clip is sterilized by a few things. First of all, when they walk in the room, if they spot a bib clip sitting open on the open counter and the operator picks it up and puts it around their neck, there's no way they know if that's been sprayed, sterilized, or whatever. Chances are it has not been. If it comes out of a little pouch that's torn open, that looks like it came out of an autoclave, that's something else. And of course, if it's a disposable, it would be very simple to see it's a brand new piece of tape that goes around the patient's bib, and that would certainly be clean. Certainly patients who have medical compromised situations are more prone, but this should cut across every patient. There shouldn't be any reason not to use universal precautions on every single patient.
with both hands. And turn towards the middle a little bit. Trying to play with the chain a little bit, buddy.
Actually,